Hi there, my name is Jessica Hubbard, and I'm going to do a presentation on the machine shop and recommendations for the University of New England in fulfillment with JPH 724. Some background and demographics. The machine shop is located in Biddeford, Maine on the University of New England's campus. The hours of operation are from 6 a.m. to 3 p.m. and there's 15 full-time employees. Some of the duties and hazards. The majority of the work is on the campus vehicles, and there's a lot of heavy lifting, repetitive motions, and exposure to hazardous materials. Areas of concerns and why does this matter? So as you can see in the center, I have back injury, psychosocial, and safety. So for back injury, there were 3 reported injuries in the last 5 years, which accounted for 10 days lost of work. The MOD rate actually decreased from 1 to 0.75, which is an improvement. For psychosocial, the employee did report working hard and fast and not having enough time to complete tasks. And this is important because psychosocial factors, they actually increase the risk of workplace injury, and they're also linked to increased tobacco and alcohol use. And for safety, we have lifting, gripping, and repetitive motion. The NIOSH lifting app is available for free. You can actually encourage your employees to download it to their phones, or you can supply a workstation or a tablet that's in the machine shop, and they can put in these calculations and these numbers, and it will assess them for risk of injury and just risk in general with lifting. And this is important because the cost of injury and compensation, OSHA reports that employers pay out $1 billion a week in the United States for compensation. And current studies do emphasize the importance of assessing both physical and mental safety practices for that optimal employee health environment. Areas of recommendation. So the first one would be to establish a safety committee. That is really important. I know there's only 15 employees at the University of New England Machine Shop, but for those employees, I think it's really important that they develop the safety committee because it helps to align with best practice guidelines, and it also helps with teamwork and collaboration and kind of ensuring that your counterpart, your team player, your fellow employee is going to be using safe practice guidelines also. And if they're not, then you can kind of do a workplace self-inspection on them. There's also accident investigations that you can perform as well. So the second one would be for culturally appropriate manuals and signage, just assessing employees to make sure that their primary language, whatever it may be, that safety manuals like the MSDS or signage in the shop is accommodating for them. I would also have more signs posted with proper PPE. I did not see any that were posted in the video. The next would be for the JRQ questionnaire. I would have the employee do this in private. That way it allows for more transparency, because if an employee is given a questionnaire face-to-face with a supervisor or a human resource individual, they might not be as forthcoming or honest as they might want to be. They might answer things in a way that a supervisor might feel they want them to answer. So that would be something that I would have them do, is just do it in private. And then I would reassess that every 6 months. For the fourth recommendation would be the vibration hazard. The calculations for that Ingersoll Rand tool did say that it was a hazard based on the vibrations and how long they were using it. So I would either limit the time spent with that consecutive use or purchase a more compatible tool. Secondly, we've got respiratory, visual, lifting precautions, and psychosocial. So for respiratory, I would have that ventilation timer set from 5:30 to 3:30, a little bit before work, a little bit after, basically to clean that air of any exhaust or ever present fumes. So also respiratory masks should be readily available. For visual, I did not see an eye wash station or any signage pertaining to visual splashes with toxic chemicals, anything like that. So I would incorporate an eye wash station. I would supply PPE goggles to everyone with easy access to the MSDS. For lifting precautions and gripping, obviously taking breaks from repetitive motion, using proper body mechanics, and asking for assistance instead of engaging in risky lifting. Psychosocial, supervisors really need to be able to recognize the signs and symptoms of stress, depression, anxiety in their employees, and just really encourage that transparency with them. So I want to thank you for your time and your conscientious effort to improve the health of your employees. Thank you. And here's some references.